Scenario 3. Chief complaint. Right upper quadrant pain, nausea, gas. Scenario: a 45-year-old female patient presents for laparoscopic cholecystectomy. Outpatient ultrasound is positive for multiple cholelithiasis. Procedure: laparoscopic cholecystectomy converted to open procedure. Suture repair of intraoperative laceration of abdominal aorta. In the opening suite, the patient was prepped, draped, and positioned. Anesthesia was maintained. Trocars were inserted through small abdominal incisions. Pneumoperitoneum with carbon dioxide was induced by insufflation of the abdomen. The patient was repositioned at 30 degrees with the head up tilt. Approximately 30 minutes post-trocar insertion during the gallbladder dissection, arterial hypertension rapidly decreased from 28 to 18 millimeters Hg. The patient developed bradycardia. The procedure was immediately converted to an open abdominal approach. Pneumoperitoneum was released, instruments withdrawn, and ports removed. The abdomen was opened via a subcostal incision in the right upper quadrant. The skin and fascia were dissected down to the abdominal cavity and retractors placed. Abdominal exploration identified intraperitoneal bleeding from a tiny rent in the infrarenal abdominal aorta, possibly during trocar insertion. The aorta was isolated and clamped. The approximate 1 millimeter rent was immediately sutured and hemostasis was achieved. Transection of the gallbladder was resumed at the level of the cystic duct. The stump was reinformed with sutures. The gallbladder was filled with numerous 3 to 5 millimeter stones. The specimen was removed and the right upper quadrant was irrigated extensively. No stones were identified inside the peritoneal cavity. The aorta was again checked for hemostasis. No bleeding or oozing was identified. A drain was then placed in the right upper quadrant area close to the cystic duct and stump. The abdominal wound was then closed in layers. Dry, sterile dressing was then applied. The patient was extubated in the operating room and was taken to the recovery room in stable condition. Diagnosis: calculus of gallbladder without mention of cholecystitis, accidental puncture or laceration during a procedure, injury to blood vessels of abdomen and pelvis, abdominal aorta, accidental cut, puncture, perforation, or hemorrhage during medical care, surgical operation. Procedures performed: cholecystectomy, suture of artery, laparoscopic surgical procedure converted to an open procedure.